There's thousands of applications that are going to every program in the country. And me as a reviewer, it's not like I have 5 to 10 minutes to read each personal statement. Hey, good evening, everyone. My name is Sujan Gogu.
Okay, hello everyone. I'm Dr. Rai. I am an adult psychiatrist.
Good afternoon, everyone. My name is Dr. Nandyala. I'm one of the critical care physician who's been practicing here since 2012 as a physician.
You know, the Dr. Gogu was saying about, it's not just about your scores. Your personal statements is looked at, people look at it.
I applied for residency. I did not have a good mentor, and in fact, I did not match the first time.
It's really what we do. It's not like we are FBI or we are going after you or so-called CBI in India. What we are trying to see is this person best fit for our program or not?
I really don't need to see your URAS application all over again in your personal statement. I think your personal statement really should be about you, what your values are. You know, we have the advent of artificial intelligence, and if you get your personal statement written by AI and we catch you writing it via AI, you're kind of sunk. You're probably not going to match at that program, nonetheless, any other program. So I think it really needs to be in your original words, and there's many ways you can really tell. If you're using an agency, for example, to write your entire personal statement and it's not authentically yourself, get a sense to really getting to know you. As now more of ERAS is very holistic in nature, as you know, step 1 scores are now pass-fail, so a lot of applications, and really what the AMC has really wanted is really a very holistic individual. And that personal statement really allows you to show that holistic side about yourself. Because I really go back and reference their personal statement and I ask questions straight up from their personal statement. And you would be shocked how many times, you know, an applicant stumped because they didn't really understand their own personal statement very well. And at the end of the day, that's going to cost them an opportunity to match. And so
we are really looking for candidates who are confident. They know who they are, and they also know how to present who they are and the way they are presenting themselves. When I said about when you tailor it towards telling your story, I want to know what motivated this candidate to apply to this field and also to a program. When I say what motivated, I am really looking for words, intrinsic motivation and extrinsic motivation. You use an AI, it will tell me very clearly if those words are being used. So touching on the AI part, that's a big problem. So there will be repetition in the personal statement if all of you start using AI. Not the repetition of the word, but that will be a pattern. Basically, you emphasize on why would they choose you? Why would you be a good fit for them? So I remember I got an interview at Mayo Clinic. In my personalized statement, I mentioned that, so I have in my family, there is some extended family who has bipolar disorder. That how I struggled with some family members, and then I asked the family, I became a physician, and it just touched me and all of that, right? My whole interview at Mayo Clinic went on to talking about familial inheritance of bipolar disorder, bipolar condition, what do I know about it? And it just, all they talked about was the family history technically about how is it, what's your experience, but you don't know. Your whole interview might just go on the 1 or 2 topics that you have mentioned because that really reflects why you are coming in this field, and it might be important to that program.
So when you go through a lot of posts on LinkedIn and then you barely scroll through like for 5 seconds, and if something doesn't catch your eye or if something doesn't interest you, you won't even read the entire post, you would skip through. Let's say something caught your fancy and then you want to read the post. So the first 2 lines is what attracted you to that LinkedIn post. Similarly, in a personal statement, the first 2 lines or first paragraph is what the reader will look for. If he doesn't have any interest in that personal statement, or if you did not raise enough curiosity in that first few lines, the reader will trash your application or probably skip your application and move on to the next one. Remember, they have to read thousands of personal statements probably in a week's time.
Wow, that's interesting. The statement, the importance of personal statement in ERAS CV, and how does it reflect your personality? It's an interview before an interview. I want all the students who have joined us to rank that personal statement out of 10. And you can put it in the chat box here.
Meena Kumari, who gave it a 10 out of 10. I'd like to know your perspective. Let me pick on someone that gave it, let's say, not a good, rating. I think an individual named Akhil Reddy gave it a 4 out of 10. I'd like to know your perspective on why did you say it's a 4 out of 10. I'm going to ask Ishita Saluja why she gave a 7 out of 10.
This personal statement, I probably would not have made it past 2 paragraphs if not for this hour-long session. Glaring errors that I can see. They take my criticism very personally and show all your anger on revising your personal statements and make it better. Programs are assuming all these qualities are given. They're not looking for somebody who don't have these qualities. They're not willing to teach these qualities during residency, right? So they all assume that you come with these qualities. So saying that I have these qualities will not give you an edge other than boring them, hearing the same thing one after another. And then there's a lot of lines where it says, I'm drawn to internal medicine because it requires thorough understanding of patient symptoms and disease course. So let's replace that internal medicine with like two of our other panelists. Like one is family medicine, one is psychiatry. So let's replace that internal medicine with family medicine. Same thing applies. Everything fits together. It requires a thorough understanding of patient symptoms and disease course. Let's replace that internal medicine with psychiatry. Same thing applies. So it doesn't tell me exactly. And then I see a lot of drama in the personal statement, like arts, values, sacrifices. Like to me, it feels like he's more dramatic than like being a good team player.
Right. Okay. In this, coming back to this personal statement, to me, I was just lost. I did not feel that this is a true story. I did not see a thread connecting. So I just didn't connect. I didn't think there is a flow. I don't think there is a story.
He's like, I penned down this personal statement. I'm kind of like, okay, well, no shit. This is a personal statement. You know, we know it is. You don't need to tell me it's a personal statement, but he did that. And then he talks about theater and like what it taught me. And I'm like, oh, interesting. That's a little bit of perspective on kind of what you do and what's your personality like. So then I'm trying to go back, you know, I'm like, okay, he talks about theater. I'm interested to know about how theater and medicine really intertwine together. So then I try to go back up and I'm trying to go read the second paragraph and I'm trying to figure out where does he talk about theater? I don't really see it. I don't see it in the third where he really, you know, talks about it again. I don't really see it in the fourth paragraph. And so I've kind of lost my interest right off the bat. So I'm now going to the next application. That's literally how it goes with people that review personal statements. Then I'll go to the next step. I'll go even further. That let's say I liked this personal statement for whatever means it is. Let's say I have to ask this interviewer questions about his personal statement or his personality. I don't really have much to go off of. You know, I can talk about the one patient he saw that had hepatic encephalopathy. I can talk about the one patient he had that I think he said latent TB or non-compliant to TB. I can ask him about what would it like, you know, growing up in a household where he had a physician in the house and really came from some level of privilege. It seemed like I really could ask him about theater and kind of how did that shape him. But overall, I don't have a lot of questions I can ask him or really talk to him about. And then that really sets the tone for how your interview is going to go, at least with me for the next 15 to 20 minutes. And so this individual would probably struggle if I, one, you know, looked over their personal statement, and then two, really asked them questions.
You know what? I'm so sorry, but without any example, these are still buzzwords for me. Your dad is a patriot. He worked for the army. He's serving them, and want to work in an underserved area, and you are leaving your beloved country. Doesn't make sense. So that means you are showcasing your dad's, characteristics, and you are seeing him as your ideal, but actually not. You're lying. Now there are two problems here. There is no specificity regarding the details of the academic journey of the student or any particular experience that have shaped him towards medicine. Similarly, using a phrase to describe an ideal physician with no details about it, what it means to you, makes no sense to me. He did not provide any details to explain deep academic learning or any specific acting experience. One, he just talked about touching upon the humanity and understanding human emotions, but acting is more complex than that, okay? Just by saying that acting experience helps the student to understand human emotion is overtly simplistic. He failed to establish a clear connection between academic pursuits and acting experiences, as beautifully said by Dr. Gogu, that he wanted to look into what was it dramatics, what he did, no connection at all, no, nothing. Now this example literally lacks depth. There is no detail about the challenges faced and the strategies used to address patients' concerns. Active communication does not just mean talking, it means active listening, empathy, and ability to tailor your message based on patient's education level. Every one of you say the same thing. One patient experience change your life? No. The life of a doctor is more like a goldsmith. There are small, low intensity impressions on your soul. You learn empathy over time. You learn to feel the pain of a patient over time. There is nothing a blacksmith approach that one hit and you bend. No, it's not an Indian soap drama by Ekta Kapoor. So please don't kill your grandparents for any reason. As an IMG, I'm a proud IMG. Yes, I learned my medicine from India. And I cracked 𝑈𝑆𝑀𝐿𝐸, and I was able to get spot in one of the best hospitals in US. But it was India that trained me by my clinical examination for my clinical knowledge so that I can beat the rest. So please do not degrade your own homeland. India is your motherland, or Pakistan, or Bangladesh, or Nepal, or whichever country you are from. Do not disrespect just to come to US. Tone is extremely sentimental, focusing on emotions rather than on concrete skills or experiences. Here, the student completely failed to provide any specific examples, which Dr. Gogu was talking about, that how theater skills can be applied in the medical setting. My panelists are amazing, they are nice, but I will give this personal statement 3 out of 10, and I will dissect it to 1 for English, 1 for attempt, and 1 for not killing his grandparents as a source of motivation for medicine. I think I will rest my case here. Thank you, Dr. Gogu. Thank you, Dr. Rai, and thank you, Dr. Nandyala. And this is our responsibility to build a next better generation of doctors. वो जो हंस रहे हैं मुझ पे मेरी नाकामियों पर, ताने कस रहे हैं मेरी नादानियों पर, काम कर रहा हूं मैं अपनी खामियों पर, क्योंकि एक दिन तालियां बजाएंगे यही लोग मेरी कहानियों पर।